other than on public transport. Okay, so this talk, as I was explaining just now, is to some extent merging together of previous talks I've given over the last couple of months. I gave a talk. The main structure comes from a talk I gave to Ronnie Tong's diploma program, which he is running under Hong Kong Youth Space, which I think is, although I don't agree with Ronnie on everything, I think at least trying to encourage more systematic policy making in Hong Kong is a really important idea. It's not something I think the Civil Service College has fully taken into consideration. And given that our government structure is largely made up of people who've been civil servants rather than researchers, and the fact that compared to other jurisdictions, I would say think tanks still play a much weaker role. So as Justine said, I spent 3 years working for the Central Policy Unit in its previous incarnation. So this is after the return of sovereignty. Tung Chee-hwa, I think, realized the need for having something a bit like the previous think tank under Leo Goodstack. I don't think we lived quite up to Leo standards, perhaps, but I think it was a valid attempt. So there were 3 full-time members, one who subsequently fell out with the government, one who had been previously arrested by the colonial government, and me. So I was sort of the moderate amongst the 3 of us. But I learned a great deal from those 3 years, not just in a sense of what policy questions I was asked to look at, but also in terms of having somebody in the team. So we had somebody on secondment from Census and Statistics who generally knew what data existed. And that made me realize how important that is. Because often data does exist, but people don't always know where to find it. However, whatever the structure is. Okay, so let me start by sharing slides. Now, I'm going to switch back and forth between my PowerPoints and some other things to show you. I haven't embedded everything in the PowerPoints, but I think everything that I'm going to show you is public information, which you can access. I've got some references in my final slide where you can find some of these materials. And I'm going to explain also in terms of trying to find some of the data that the government has and reanalyzing that. Okay, so let me start with the PowerPoint. Okay, I hope you can all see the PowerPoint clearly now. So, as I mentioned, I was previously a full-time member of the Central Policy Unit. So this is the unit which has been reincarnated in the current administration under Stephen Wong. I think it's now called the CE's Policy Unit. So at that time, we had a very clear statement that said the Central Policy Unit served the 3 top officials, not just CE, but either CE or Chief Secretary or the Financial Secretary could raise a question which they wanted us to look at. And I think I'll mention about 1 or 2 of those questions later on. As Justine said, I was previously Dean of Social Sciences. That's quite a long time ago, 30 years ago, yes. So I was the youngest dean in those days, very different environment. And then I spent 30 years running the Social Science Research Center, where we often collected data for the government or for academics or even private companies and did some analysis. Unfortunately, as I will reference later on, a lot of the data we collected for the government was never made fully open. And in fact, I'll explain a little bit later on. There are some data sets where the government paid for the collection, in some cases millions of dollars, and yet those data sets have effectively been lost. So I have a rather strong view on the need for public records, for proper public records. Okay. So because I was giving this talk to Ronnie Tong's group, I started to think about how we should handle policy questions. Now, as it's just being pointed out to me, of course, whether the analysis that's being used for answering policy questions ever influences the policy is another question. There are political considerations that may overrule what we may see as a scientific analysis of the issues. But I was trying to get people to think about how we should handle policy questions. Maybe this should be how we should handle policy questions and rather how we do. So obviously we need, first of all, to examine, is there any research that will help answer a particular policy questions?
Make it bigger.
And how do we find it? Now, of course, local research has the advantage usually of being much more relevant to any policy question. But the question is, how do you find it? So I'm going to say a little bit about how you might find it. Overseas research.
Me? Yeah, John.
Yes.
Can you make your slide bigger?
Oh, so it's not filling the screen? Okay, let me try again. I'm going to exit. Okay, let me move it onto this screen. Okay, let me try sharing again from this screen. Is that filling the screen now or not? Is that okay?
Yes, okay.
Okay, good. So, let me go back. So, obviously, we would like to use any research that exists to help answer a policy question, how to find it. So most people know how to use Google. They may or may not know how to use Google Scholar. So Google Scholar is similar to Google in the sense that it goes out and searches the whole internet. But Google Scholar generally only includes papers which it thinks are, first of all, academic papers which are being reviewed in a proper process. So any paper that anybody has published in a recognized academic journal will normally show up in Google Scholar. Plus, anything that appears in a university archive. So I will show you something about the Hong Kong Youth Scholars Hub, for example, will normally show up in Google Scholar. Now, of course, whether you can access that paper, having found it in Google Scholar, is another question. So many academics do put a copy of their papers in a way that can be downloaded as a PDF. Not everybody does that. Some people, frankly, don't care very much. They assume that you can access it through a library. So we'll talk about that in a minute. Question, of course, is that if the research doesn't exist, there might be some data out there which can help us answer that question. But that assumes that you know how to analyze that data and you understand the weaknesses of that data set. So there might be biases in that data set. So, for example, telephone survey results, which you see in the newspaper in Hong Kong. Most telephone surveys in Hong Kong currently are biased. As recently as 3 years ago, a sister institution to Hong Kong U had people doing telephone surveys that only used fixed line telephones and insisted that that was a representative sample of the Hong Kong population, which is simply untrue. Trying to find anybody under the age of 30 who still has a fixed line phone in their home is hard, right? So fixed line phone as a basis for a telephone survey, highly biased against young people. There are also lots of people who are using robocall telephone surveys, highly biased, the response rates are extremely low. So we at least need to be aware of any biases in the data if we think there is a data set out there that could help us answer the question. And that doesn't get into the topic of design of the questionnaire, whether the questionnaire design is biased in the way it's framed. So again, I also will show you guys a link. So I taught for the, one thing I didn't mention at the beginning is I taught the quantitative research methods course for the graduate school in Hong Kong for about 20 years. I have those materials in open access, which highlight some of these issues. Then, even if you know that the data exists, can you access the data? So one of the few things I'm proud of is that the public policy research scheme of the government, I turned up to one of their consultation events and they asked the academics present what they could do to improve the scheme. And I said, number one is to make all the reports open and to make all the data sets as open as possible. Somewhat to my surprise, they agreed. So in principle, all public policy research funded by the government, the data set is open. However, as I will show you later, in practice, that may not be the case. What if the data doesn't exist? Then obviously we need to collect data, may need to do a survey, we may need to do an experiment actually to answer some questions, or there may indeed be administrative data that already exists. So if we're talking about population, for example, that the population estimates are based on admin data, and we'll talk about that one particularly later on. If we're going to use that data, what assumptions and models are underpinning our use of that data? Often if somebody has analyzed it, they may not have stated explicitly how they analyzed it. And lastly, a really crucial point is however experienced we may be as methodologists or as statisticians, do we actually have the domain expertise necessary to frame and ask the questions that are needed to answer that policy question? So if this was the question on language, do I have a linguistics expert? If it's on education, do I have an education expert? Those are really important. However smart we may think we are, there's almost always important elements of that topic which are known by people in that field, which if we're not in that field, we may not fully understand. So let me just stop for a moment. Let's just have a look. I'm going to stop that share. Let's go into... So if I go into Google Scholar, let me share this. Let's make sure I go to the right page. Yeah. Okay. So if you go into Google Scholar, you see something like this. Now, what it's showing here is what is articles it's recommending for me. Because I'm logged into Google, you will not see the same page as I see. So this is articles which Google thinks I will want to see. But we could look at anything. So we could look at, say, Hong Kong population. or Hong Kong languages. So then it will show us books and papers which we think are relevant. You can select by date. You can select by type of article. So, for example, this first one, Multilingual Hong Kong, this is a single author book by this guy who doesn't draw on the research insights of others, frankly. The third one, interestingly, I had a role to play. I was the statistical consultant for that third article by John Gibbons. It was a very important article in Hong Kong terms because it talked for the first time in a serious way about code mixing models. Code mixing meaning you mix English and Cantonese, for example, in your conversation. So that's a crucial issue. So I think somewhere if you read that article, you will find an acknowledgement to me. And then the fourth book, Language in Hong Kong at Century's End, I'm the co-author of an article in that one. So, but you can put any topic in here. And unlike the normal version of Google, you can be reasonably assured that most of the things that are shown up in Google Scholar have had a proper review process. That's not always true, but that's usually true. So you can see it does distinguish that first one and the fourth one are books. The other ones are academic articles. Now, as I said, you may not be able to access them. You can notice on the right-hand side, the second one here has a link to a PDF version on academia.edu. So academia.edu is a sort of what we might call a gray website. Dubious legality, but they have lots of PDFs of articles. In theory, these should be the preprints of the article, not the final version. So the final version is usually copyright by the publisher, which you can't get access to without paying money, or being a subscriber to a library that gives you access to that. But the academia.edu should be normally one that hasn't been typeset, but usually contains all the important information in that article. But you'll see these other ones, there's no PDF to download listed separately. So it may well involve money or using a library. So one of the things which I tried to create in my time, or to support, I should say, I wouldn't claim I created this, but I influenced, is the thing called the Hong Kong U Scholars Hub. So if you go to the Hong Kong U Scholars Hub, you can here search for publications of all Hong Kong U scholars. And as far as possible, we try to make sure that these articles are deposited in the hub so you can download the article. So we've got here the star chemist. Vivian Yam is the featured scholar, but you can search for my name, for example, and you will see things that I have written here. You can click on my name and see my contact information, which is almost certainly out of date. Given I've retired from Hong Kong U, it's still showing my old office contact, which won't work. But you can see on the left-hand side, it tells you my background. But more importantly, it's got my publications and my data sets. So I have a public policy research data set that exists here, which I have shared with the government, but they haven't yet made it available. So for at least Hong Kong U academics. Now, Hong Kong U now has a much better system for the data sets than the one here. We click on data sets, yes, see whether it shows us. No, it doesn't. So anybody who's interested, Hong Kong U is using a very good system for sharing data sets. I believe Baptist also has a similar setup. The other institutions are a bit behind. So in my view, all the universities should have a proper system to let you deposit and share data sets. Unfortunately, for reasons I'll talk about later on, that hasn't happened to the extent it should have. Okay. So that's showing you two sources. Now, let me show you one last source. So this is public policy research. And this just shows you how clueless the government can be sometimes. So previously, Hong Kong U used to have a link to my report of my public policy research that I did for the government. I think I have 3 completed public policy research projects. However, the government, in its great wisdom, decided a few months ago to change the website on which all these reports are stored. So they all used to be on the admin wing.gov.hk. Now they've switched them all to CEPU. Right? So every single URL across the internet that was finding these reports broke overnight. Nobody seems to have even noticed that this was the case. So I insisted that Hong Kong U, instead of showing the link to the government's version of my report, actually place the report in the Scholars Hub itself. But I'm sure there are many others where you will find that the link has broken across the internet. So the Public Policy Research Funding Scheme doesn't require that you work in a university, but you have to work in a body that the government recognizes as doing policy research. And basically, you have to have a finance office that the government recognizes as trustworthy for distributing the money for your research. And you cannot pay yourself from the Public Policy Research Fund, but you can hire people to do the research for you. You can use that money to both generate data sets, pay for access to the government data sets, and pay for the analysis of those data sets. So let's just have a look. So it's, yeah, see, it's broken. So Google's link to the admin wing is broken because the government in its wisdom decided to take that away. This is the new link, the CEPU. So if you look here at the link for research reports, public policy research scheme, and you can search through here. Let's just quickly search for my name. So this is the one that I'm going to, well, this is one of the ones I'll reference today. This is the first language study I did called Language Use, Proficiency and Attitudes in Hong Kong. But you can find this report in the Scholars Hub. And then further on down, I can't see my cursor. Let's have a look. Further on down here, there should be another one. Never mind. Anyway, there's 2 more recent ones, one on stalking and one on another one on language, which I'm going to show you in detail later on. Anyway, let's stop looking at this. Let's go back to my PowerPoint. And let's switch back to proper mode. Okay. So what about government data? So what government data can we use? And there is 4 main things I want to talk about. The first 2 I'm going to explain in a little bit more detail. So census data. So census data, in theory, the census happens every 10 years, but there is a bi-census every 5 years. A restricted question set. Census has considerably improved over time. Now you can often build your own tables on their website. But unfortunately, the self-build has certain restrictions, which may mean you can't generate the tables you want. The main restriction of the census data, though, is that because it's being done on such a large scale, the number of questions included in the census data is limited. But we need to distinguish between the questions used in the full census and the ones in the sample. So, for example, in the 21 census, the 10% sample answered quite a long list of questions. The other 90% only asked a very trivial list. The second source I'm going to talk about is the thematic household survey. This is irregular, but it covers many very important questions which may be relevant for policy. Third census also does the general household survey. This has quarterly reports. It focuses primarily on employment and now has self-build tables. And I will show you an example of these self-build tables later on. And lastly, but by no means least, OGO has data.gov.hk. This is the single best source for government data. In theory, it includes the public policy research data I mentioned, although currently you can only find the reports from 2013 and 2014. Their data sets, a lot of it is missing. It also has a link to the government's new geospatial data hub. And we may say something about that later. So I'm going to talk primarily about the first two because I think those are the ones usually most relevant. So census data. So the census data, as I mentioned, every 5 years there is a census data set. The latest, of course, then is 2021. The next will be 2026. So they have many tables and reports which are openly available. So they follow good practices. It's all in PDF format that you can download, but they also, many of the tables can be downloaded as CSV or Excel format, so you can use them for further quantitative analysis. So they have a website that allows you to generate tables. But the bit that gets me excited, and I will show you something more about later, is that academics can also do a detailed analysis of the 10% sample. So that 10% sample means then about 270,000 households, around 720,000 people. So that's a very large sample. And this you have to use the secure enclave in the census offices. You cannot have that data set to run on your own computer or take it home because of the privacy risk. And even if, when you do the analysis in Census Office, they will check your outputs to make sure you haven't done something stupid and to check that there is no privacy risk. Now, in fact, the privacy risk, in my view, is relatively low for most situations because it's only a 10% sample. And frankly, most people don't even remember whether they were in the 10% sample or not. So this is a very large and representative sample. So for those of you who don't understand, representative means we can reliably project those findings to the full population. So as I mentioned, most telephone surveys in Hong Kong are not very representative, at least not unless they've had some adjustment. So with such a large sample, we can examine small subpopulations. So for example, we could look at household characteristics. We could say we're only going to study single person households. We could say we're only going to study families. Or we could look at individual characteristics. So we could look only at the people who are currently unemployed, or we could look at people who are all currently not in the labor force. So there are many different subpopulations we could look at. It also includes geocoding of the district council constituency areas. So the 20 district councils, to be honest, are not that interesting because they're so big and so diverse. but the constituency areas, there are over 450 of these. That means each of them has about 600 households or about 1,600 people sampled. So this allows quite detailed spatial analysis, and I will show you an example of this later on. And this has been, I would say, underutilized for sure. There are very few examples of good analysis using the geocoding of census. I'm going to show you one that relates to language later on. But the more I do work on this, the more I have ideas for new things, new and interesting policy questions. So I have a new public policy research proposal I hope to submit in the next week or two, which will look at some other questions which I think haven't been fully asked yet. Now, one of the other talks I gave asked the question about subdivided flats. So, in fact, the census data includes what's called a household reference number. So that distinguishes households using the same living quarters. So we should be able to divide subdivided living quarters in the census data set. Although that's only a small population, subpopulation, again, the census data set is big enough, this can be looked at. And in fact, there is a census report specifically on subdivided living quarters. That in itself is already a good start, but often, as I will argue later on, what we need is to do comparisons, and that can't be done using that report. Okay, the thematic household survey data, as I mentioned, this is an irregular series, but it has lots of important research topics, such as persons with disability and chronic diseases. So that's really important. That's the single best source of information on disability in Hong Kong. To be honest, it's quite hard to get good information on people with disabilities outside of this. They had a question set on desire of economically inactive persons for taking up jobs if being offered suitable employment, meaning basically, how might we get people back into the labor force? So it may be interesting to some of you if you want to start getting a job again. There's a topic on use of language. Unfortunately, they changed the response scale on those questions. They've done this more than once, but the last time they did this, they changed the response scale from one not very good response scale into another not very good response scale, which means they can't actually make proper comparisons. Very stupid decision in my view. My understanding is this was at the request of a department or bureau. So I do have some sympathy with census, but still. And then there's another one on the training needs of economically active persons, meaning basically how can we upskill people who are in the labor force, perhaps so that they can be a better match to the needs of employers, or maybe how they can get better jobs. So this is a relatively large, relatively representative sample. So the THS normally is about 10,000 living quarters, and it does record households per living quarter. So again, we could do subdivided flats, but it does have some weaknesses, which I was quite surprised to find 2 years ago when I looked at this in some detail. I'm hoping this is going to change. I've encouraged them that they currently don't record whether there is a foreign domestic helper in the household. So, for example, the issue about economically inactive persons, right? One of the key questions is there somebody helping at home that will enable the mother in the household to go back to work? We don't know because it's not recorded. It also has some weaknesses that it doesn't cover all non-Chinese speaking households. As far as I could tell, it assumes that there is at least one Chinese speaking member of that household, because this fieldwork is outsourced and the government unfortunately doesn't hire high quality fieldwork From my perspective, they don't require that the fieldwork staff are able to communicate in languages other than Cantonese. They don't even speak Putuan necessarily. Now, again, academics are allowed to reanalyze these data sets, and I will give you an example later on of how I did this. So there are some reasons why these data sets may be much better for some purposes than census. So, for example, language. The census data set only asks which languages you can understand and read and write. It does not ask what level of competence you have. So it's a binary scale. I do or I don't. Whereas the use of language questions does have a level of competence question, even though it's self-report. So that turns out to be very useful, because if we want to understand how level of competence plays into, for example, your ability to get jobs, this is a good source of data still, despite its weaknesses. Okay, so let's start looking at a few research questions. So I'm going to start with a reasonably topical one. How well did Hong Kong handle COVID? So this particular question came up in my mind. The South China ran an article, and the article made some good points, but the table in this article was drawn up by the journalists themselves, and the journalists clearly don't understand statistics, and they don't understand epidemiology. So let's switch, because I want to show you this table. But before we look at it, one of the questions is, what is success? Right? So what is success? So to me is, people didn't die is success. Right? I would argue that's the most fundamental version of success for COVID. So you may have noticed the UK is currently having an inquiry into its COVID response. In Hong Kong, the government has declined to do this, which I consider to be a serious mistake. I believe Hong Kong should review it, not in order to criticize. So after SARS, you may remember, the Minister for Health resigned. And he was a very competent Minister for Health, and I think that was a serious loss to the Hong Kong government that he resigned. But I think the fact that we had an inquiry into SARS is one of the reasons that Hong Kong did a much better job at COVID than our competitors, right? Our competitive jurisdictions. I'm going to ask you the question, what do we know now affects COVID infections and deaths? In fact, I'm only going to look at one of them. Obviously, the two main interesting things, of course, are vaccination and masks. Unfortunately, on masks, even the academic literature has problems. And what is missing from the SEMP table from a purely statistical view? So let me exit from this again and find the South China article to show you. Where are we? Okay. So I'm going to show you two things. So we're not going to look at, so this is written by an academic at UST, who also is clearly not an epidemiologist or a statistician. So maybe I think he believes he's a policy analyst, which he may well be. I'm not going to take you through all of this. I just want to scroll down to the table. Okay, can you see the table? So it compares Hong Kong, Singapore, Japan, and South Korea. Okay? So I need to move my Zoom bits off my screen so I can see. And Malaysia, right? So it compares Hong Kong, Singapore, Japan, South Korea, and Malaysia. What's the first line? COVID deaths. Well, this is a terrible basis for comparison. Why? I hope you all know what the answer is. Because Hong Kong and Singapore are much smaller than Japan and South Korea. So the implication that Singapore did a wonderful job simply because it had fewer deaths is in itself not a reasonable basis. right? Now, we can say, yes, the third line is a much more reasonable starting point. COVID deaths per 100,000 people, right? So this indeed does show that Singapore did well. Now, there are some problems with how we counted COVID deaths, right? So in some jurisdictions, if you had COVID in the I think it's preceding 2 or 4 weeks before death, you were registered as a COVID death. In some jurisdictions, they basically had to find COVID-driven pneumonia in your lungs before they registered you as a COVID death. So almost certainly the COVID deaths in some jurisdictions, such as the mainland, are a massive underestimate. And in other jurisdictions, such as Hong Kong and the UK, almost certainly was an overestimate. So to be fair, he does also have estimated excess deaths. So this is basically saying how many people died during the COVID period compared to how many we would expect to die over that period. So how do we work out how many we expect to die? So we look primarily at age and sex specific death rates normally. So if you look at, say, the 5 years prior to COVID, how many people died in each age and gender group per year in that 5-year period? Match that to the demographic profile at the beginning of COVID. How many people would we expect to die during the COVID period, and how many actually did die? Now, of course, here there's a slight problem. He says excess deaths, but he doesn't actually say very clearly. If I understand correctly, it's excess deaths over the 3 years of COVID. Okay? So again, excess deaths alone is not meaningful. Excess deaths per 100,000 people, this is much more reasonable. So this shows you, actually, South Korea did as well as Singapore, right? So South Korea and Singapore arguably did the best with about 80 excess deaths per 100,000. Then comes Malaysia with about 110. Then comes Japan with 130 and Hong Kong with 189. So you can see actually on excess deaths, Hong Kong didn't do particularly well. However, to trade off that, we did not have lockdowns, right? At least in theory, although of course we did restrict public life in many ways. Now, one of the things that's missing from this, of course, is those 100,000 people, what's their profile? So one thing that was quite clear in COVID is that elderly people were at greater risk. So how many elderly people were there? So in fact, you can see Japan has far more elderly people than any of these other jurisdictions. So in fact, that 132, although it's the second worst in Japan, actually, given how many elderly people they had, maybe that wasn't too bad. And then lastly, you've got GDP growth. So Hong Kong looks the worst there, but that's GDP growth in 2022, what I would argue is a very strange way to evaluate the economic outcome. So at the very least, to me, they should have compared the 2022 back to the pre-COVID GDP. So this is, in my view, a very strange way to evaluate the economic outcome. Okay, so now let me show you something very different. So this is using data which is publicly available. Now I've got to find my chart. Got to find the correct chart. Okay, so this is based on the case fatality rates which the government published. Let me share this. Okay, so can you see my chart? Okay. So this is showing you data from January 2023, January 29th, 2023. I think this is the last data set that the government published. So I took that data, restructured it, and represented it. So this is showing you how many people died per 10,000 by age and vaccination. Okay? So this is saying amongst the people who got COVID, what proportion of them died? So this is numbers per 10,000. So the line about the middle of the graph says 1,000. So this 1,000 means you have a 10% risk of dying if you got COVID. Sort of halfway between the two bottom lines is 100. That would be a 1% risk of dying. Okay? So what do we see? So that I've shown you by 5 levels of vaccination. 0, 1, 2, 3, and 4. Actually, that should be 4 plus, if I remember correctly. So you can see, actually, the colors are a little hard. I don't know whether you can distinguish the two colors of blue. So anyway, dark blue says, if you insisted on not getting vaccinated, what's your risk? You can see for people who are aged 80 plus, the risk is about 15% of death. So that's a staggering death rate, right? So 15% of people over 80 who got COVID and didn't get vaccinated died from COVID. If you're in the 70-79 group, the risk was about 4%. Still pretty high. If, like me, you're in the 60 to 69 group, it was about 1.5%. Still, most of us don't want a 1.5% risk of dying simply because we didn't get vaccinated. However, when you get down to the 39 group and lower, you can see we cannot even see the fatality rate. So this says, if you've been following the UK did many things wrong. They had a ridiculous prime minister who is now fortunately not only being sacked as prime minister, but sacked as an MP, which he deserved to be because he couldn't tell the truth. However, the public health policy laid down by the public health people in the UK are very capable. So their strategy said, we vaccinate the elderly first. Clearly, that part of the strategy was correct, right? If you have a limited number of vaccines and you want to reduce deaths, you vaccinate the elderly and work your way down, right? Hong Kong, this makes it very clear to me the real problem was we still had so many elderly people who didn't get vaccinated because our private care homes insisted that they would not get people vaccinated unless the children of those elderly people also consented, which is utterly ridiculous. Anyway, let's not get sidetracked. This shows very clearly what the story is, right? Vaccination and age are the two key issues. So you can see 1 dose helped a lot, but roughly halved the risk. 3 doses halved the risk again, and a 4th dose helped a little bit more, particularly for the oldest group, right? So basically, if you had 4 doses, your risk was still very low unless you were aged 80 plus. And in fact, the 80 plus, you think about it, the normal death rate is not that low, right? And in fact, what we don't have on here for comparison is flu. So this is COVID case fatality. But one of the interesting things is because we all were going around wearing masks, the flu fatality rate in Hong Kong was very low during COVID because the masks not only reduced the risk of getting COVID, they also greatly reduced the risk of getting the flu. And each flu season, many people aged 80 and above die from flu because many of them do not get vaccinated, right? So for those of you who are in my age group, I encourage you to take your yearly flu vaccine. This indicates how much this type of disease, which affects the lungs, really has a very strong age effect. So if I showed you the graphs for the flu, obviously the fatality rates would be much lower, but it would again show that vaccination is the key thing to reduce your risk. Okay. I think that's enough about COVID. Let me go back. So, what is my point? My point is people who think they understand the story and what data is relevant don't always understand it. So this guy, at least he did understand it. Looking at, say, GDP alone is not very helpful. Looking at death rates alone is not relevant. We need to at least look at what's the appropriate scaling. So clearly for COVID deaths, it has to be per 100,000 or per million population. Otherwise, it's not a meaningful comparison. And you also need to look at the risks of measurement, right? The quality issues of measurement. So most people do not understand what reliability and validity are. Reliability basically means, do we get consistent measurements if we repeat it? Validity means, are we measuring the right thing? So in this case, the validity of the officially recorded death rate is not high, right? Because it's very hard to determine whether COVID really is the primary cause of death, right? And what is primary and secondary, it's very hard to detect. So that's why the excess deaths are probably a much better basis for comparison across countries. But again, that assumes that you have very good records of infection and of death. So in Hong Kong, as you may know, nearly all deaths take place in hospital. So generally, the quality of the information about cause of death is high compared to other places. Okay, let's go back to the PowerPoint. Right, so let's look at another question. So we've got Fred Ho here, who was Commissioner for Census and Statistics at the time I was looking at this question. So I mentioned I was working for the Central Policy Unit. So, and that we could be asked to look at questions by any of the three clients, meaning Chief Executive, Chief Secretary, Financial Secretary. And the first question I got asked by CE, or rather it was handed down to me, was, what is the ideal population for Hong Kong? And I thought, that's a really strange question. Why would you have the concept of an ideal population? And I then gave it a little bit of thought. So I'm trying to work out what does he mean by asking me that question? But then I remembered. So as you may know, Tung Chee Hwa, his academic training was as a marine engineer. I think University of Liverpool, if I remember correctly. So this is the sort of question an engineer might ask, right? You're designing a ship. What is the ideal size of a ship? So if you make the ship too big, then it easily breaks. So Titanic, we've just been reminded of again this week through a very sad event. Right? If you make the ship too big, it's relatively easy for that ship to break up. If you make it too small, it costs too much to run the ship in order to deliver the cargo. So it's an optimization problem. So that begs the question then, what do we mean by the ideal population? And in the paper I wrote, I tried to persuade him that this is maybe not the key question. But I said, so Hong Kong is a very unusual place because it's essentially a city-state, although we're not an independent city-state, but it is essentially a city-state like Singapore. And we can look at other cities in a similar situation. So normally we compare with Singapore, but in fact, there are other cities which have certain similarities. So we had a seminar in the Central Policy Unit where the mayor of San Diego came to Hong Kong. So San Diego actually has a number of similarities to Hong Kong because it's right next to a border. And a key element in San Diego is people crossing the US-Mexico border. And whether people travel across that border on a daily basis to go to work. Because it's obviously, so that it's not just that there's a border next door, but that the state of economic development, both sides of the border are very different. Now, of course, Shenzhen has caught up a lot to Hong Kong. So the difference is now a lot less, right? But it's still cheaper to live in Shenzhen in terms of, say, property cost than it is in Hong Kong. And at the time we were doing this, so this is 2000, at that time, the cost was still much cheaper in Shenzhen than in Hong Kong. So the issue of ideal population begs all sorts of other questions. So I wrote another paper on the rights and responsibilities where I basically pointed out it's not just what's the ideal population. You have to think about how cities normally work. So if you look at, say, London or Paris or New York, many people who work in London, Paris, and New York do not live in London, Paris, or New York. They live out in the suburbs and they come into work on a daily basis. That's number one. Number two is where you choose to live often has to do with what stage of life you're at. So, for example, my son is 29. So for somebody who's 29, you want to live where the life is. You want to live downtown. You want easy access to restaurants and bars and other young people, right? You don't want to spend you don't frankly want a big house out in the suburbs. However, once you have a family, then you care about different things. You want more living space. Maybe you want a garden. Now in Hong Kong, if you want a garden, you probably have to live out in the relatively remote areas and new territories. But in most cities, the suburbs are connected up. So Shenzhen was much less connected up, and even Shenzhen increasingly was becoming a city rather than a suburban environment. So the issue is, people may want to commute back and forth, and actually what you should want to do is to facilitate a good life for the people living in your community. So what is a good life is for them to decide, not for you to decide, right? So, but if somebody lives in Shenzhen and works in Hong Kong, do we consider them to be part of the Hong Kong population? What if they live in Hong Kong and work in Shenzhen? Do we consider them to be part of the Hong Kong population? And in particular, it gets even more complicated. What if somebody works nights in Hong Kong? So they sleep the day in Shenzhen and then come to Hong Kong at night to work, right? So it's not easy to define who should be part of the population. But we do need to have a definition, a working definition, and we need to look at the issues around the measurement of that population. We need to understand how that population is changing. We also need to understand immigration. So here I'm only looking at the issue of family reunion. The broader issue of immigration and talent schemes is another whole topic. And interestingly, so one of the issues is when we were looking at talents, we tried to compare with Singapore, and we talked to the top academic on immigration in Singapore. Unfortunately, she could not share her findings with us because the Singapore government would not let her share her research. So let's just say sensitivities are different in different places. In Singapore, the sensitivity is anything that has to do with race, because the Singapore government basically prioritized Chinese talents, not talents in general. That also then begs the question, how do we predict the future population and what assumptions we need to make? So that basically means assumptions about immigration, assumptions about fertility, and assumptions about death rates. And then lastly, what does the government need to do in order to respond to those changes? So that basically means what infrastructure. So, for example, one of the things I looked at for CE was the land supply in the coming years and whether that land supply, how insufficient that land supply was. If we assumed certain densities of property on that land. So obviously this sort of work had been done by the people in planning department. So I didn't have to go off and do the research myself. Sorry, I jumped out of here. But I could go and find what I thought was the most relevant bit of what planning department had done in order to give some broad oversight. So a lot of their work is very detailed about specific types of infrastructure. But I went and asked them questions about what their current estimates were for the land supply and for the need for that land, for the population. So let's have a look at some of the data. I want to just show you one aspect of this. We're going to look at I'm going to switch my graph here just a minute. Okay. Make sure I got the right one. Okay. I hope you can see my population graph. Can you see it? So this is showing you a graph of 4 sources of data about population. So the red line is showing you the actual population as revised historically, right? So using the current population definition, the red line goes back to about 1995. The purple line is the actual population as stated in 1998. So the population definition changed in 2000, right? So before 2000, the purple line was the official population of Hong Kong by year. And then we changed the definition in 2000, and they went back and recalculated the population using the new definition. So that's why there is some years from about 95 to 99, I think, or 98 or 99, where you have both a purple line and a red line. Okay, so you can see at the time I was doing this research in 2000, we didn't have the red line, we had the purple line. So the purple line, you can see the growth rate. So this is on a absolute scale. If I should really show this on a log scale, but to make it easier to read in the way that we normally see these graphs, this is on absolute scale, right? From 5.5 to 8.5 million. But you can see the blue line is the projections that had been published. So the situation that I was faced with was the purple. This was what had actually happened, and the blue, which was the current projections at that time. So you can see, based on those projections, we would already have had a population of 8 million in about 2013. All right. And so for reference, we still haven't reached 8 million now. As of today, we're not. So the red line shows you where we are today. So the latest, this is, I think, mid-year. So I think 2022 mid-year is the latest one I've got there, where we're back down to what, about 7.3 million, I think, something like that. So you can see that the perspective of government at the time I was looking at this was that the population growth rate was very high, right? Now, arguably, some of that was to do with problems with the way the population was being measured. Now, when we changed the population definition in 2000, the crucial thing we need to understand, population is recorded in the census in a very accurate and reliable way, right? So there's no problem. When you get to the census coverage in Hong Kong is very high. In other words, there are not many households where we don't manage to find out whether anybody is living there and how many people are living in that household. The real problem is what happens between censuses. So we have a 5-year gap between censuses. So how do we adjust the population in between? And unfortunately, before 2000, Hong Kong was adjusting the population in a way that turned out to be problematic. So when Fred was the commissioner, they published a report explaining why they changed the population estimates. To be honest, I don't think that tells the full story. In fact, if you go back and look, it's not hard to identify what the problem was. So the problem was that historically, Hong Kong, in its colonial days, whether you think it was a colony or not, doesn't really matter, but the pre-1997 period, Hong Kong made a distinction in the way that it adjusted the population between people who left Hong Kong for the mainland and people who left Hong Kong for everywhere else. So normally, most countries, when they count the population, they make the adjustment, they rely on the immigration data to say how many people left, how many people came in. That's the adjustment we make, okay? So if in a particular month, 100,000 people left and 110,000 people came in, we would say the population has an increase of 10,000 due to in and outflow. We might also have 5,000 births and 4,000 deaths. We would have another increase of 1,000 due to births and deaths. So we know how much we need to correct. Now, if it was as simple as that, Hong Kong would not be in trouble, because we generally know. So since the one-way permit scheme was introduced back in 1980, Hong Kong generally has a very accurate estimate of how many people come in and out, right? So pre the one-way permit scheme, there were people swimming across Mears Bay or coming in on snakehead boats. So there were a significant number of people coming in and out of Hong Kong, which we didn't count. So it was problematic. But again, when census came along, every 5 years, we would correct those population estimates and everything was fine. However, unfortunately, during colonial times, somebody in their wisdom made a decision to count in and out to the rest of the world in a sensible way, but the in and outs to China were counted in a stupid way. What they said was, if you go to China, we assume you're coming back very soon. So we won't, if you leave to China, we won't subtract you. And if you come in from China, we will not add you back in. Now, the vast majority of people going to and from the mainland in Hong Kong historically have always used the land boundaries. So the land boundary, that works fine, because everybody who goes through the land boundary is leaving for China, and everybody who comes back is coming back from China. So excluding that flow from the population isn't a big deal. The issue comes when we look at the other routes, right? So if we look at the water routes, that generally also wasn't a big problem because most people who go to Macau will come back from Macau. Although it turned out there is some problem because people might take the jet fuel to Macau, walk across the border from Macau into China and come back by the land boundary, right? So some people might leave by water and come back by land. But generally, most people going to the mainland would leave for the mainland and come back from the mainland. That's generally it's definitely not a problem for land. It's a tiny problem for sea, but the airport is a problem. So, in fact, there was a letter in the South China the other month, somebody asking a question about, what information is collected when you leave or come into Hong Kong. So you think about it. When you go through immigration, when you're leaving, you have to show your boarding pass, right? So it's obvious where you're going to, at least where your initial destination is. But when you come in at the airport, immigration usually don't want to spend the time to ask to see where you're coming from. They don't ask to see your ticket stub. So how does immigration know where you come in from? Well, the honest truth is they don't always know. So they weren't able to accurately distinguish between who was coming in on a flight from the mainland and who was coming in on a flight from anywhere else. So there was a flaw in the way that we were counting people. So the real difference between that purple line and the red line, I would argue, has nothing to do with the population definition. It has to do with errors in the way that it was being calculated. So I'm not stating a view on whether the redefinition was a good or a bad thing. So we now distinguish between mobile and resident population. Most countries actually talk about the citizen population, the resident population, and visitors. So that's just a different way of looking at the problem. Again, the implication of visitors is quite different from residents, because if you're a visitor, you're generally not going to be using the healthcare system. You certainly won't use the education system and so on. So you do need to distinguish between people who will use government services and those who won't. But we do need that distinction. But you can see the government was planning everything in 2000 on the basis of a very high growth rate, which turned out not to be true. All right, so let's look at the current problem. So we now are faced with a situation where the green line is the prediction, the latest prediction. So this is, I think, 2015 or 17. So this is telling you the government's current predictions for the future population. And you can see that COVID means we're now quite a long way short of those predictions. The question is, are we going to get back up? So the government now is boosting up the talent scheme. I think they were claiming they've got they're expecting 100,000 extra people. So let's say that the talent scheme gives us a boost of 100,000. You can see that will not bring us back to the green line, right? However, the reality is, as Hong Kong gets back to normal, we're looking at you, Cathay Pacific, right? Well, the red line may almost certainly will start to bend up again, but probably the assumptions will need to be adjusted. Now, the way the calculations are done for the green line, there's essentially two parts. Again, the immigration flows, as we mentioned, which is the part which is very hard to predict, and the part which is births minus deaths. Now, births minus deaths, as we've just discussed in the COVID situation, wasn't what we would expect during COVID, right? We had far more deaths during COVID than you would expect. That was the whole point, those excess deaths. So the relatively sophisticated methods that census now uses for predicting births minus deaths turned out not to work well thanks to COVID. So they will have to recalibrate those models after COVID, because we now have lost quite a lot of plus 80 plus people in Hong Kong. So that will mean actually when the flu season hits next winter, we may well have less deaths because some of the most fragile people have already died. So we have the survivor effect. So there are a number of complicated questions that we need to look at. Okay, I think that's enough on population. But we can now, we can come back to a related issue. So one of the specific things about responding to change is fertility. So do we want to increase the fertility rate, right? Or can we just import labor? So that's arguably one key part of the choice. Or indeed, you could even say, or can we just accept a lower population? What's the problem? Well, the problem is that the elderly in the population are supported by the younger ones. So if you have a very high proportion of elderly people relative to people who are working age, you may have a problem with your public finances. Now, of course, that begs the question, which we'll come back to later on, about whether you want to encourage people to keep working, or you essentially discourage them by saying, once you reach age X, you should stop working. So we'll talk about that a bit more in a minute, but let's just talk about the fertility part. So what affects fertility in Hong Kong? Well, unfortunately, the government itself doesn't really collect much useful information on what affects fertility. Fortunately, a subvented agency does collect that information. So let's just go and have a look. Well, in fact, I was going to show you the knowledge, attitudes, and what's P for? So there's this regular survey done every 5 years by the Family Planning Association of Hong Kong. And I thought, I'll just show you the report. Unfortunately, some point in the not too distant history, about 10 years ago, the Family Planning Association decided they don't want to share their reports. So let's have a look. So if we have a look at their webpage, so again, we'll come back to this later on, but this says to me, this is what you shouldn't be doing. So let's have a look at their page. I've lost that's the problem with having so many windows. I can't find the right window. Where's my Safari? Oh, here we go. So this is the Family Planning Association webpage. If we look at their resources and research and studies, scroll down. Okay, so the latest relevant survey, knowledge, attitude, and practice survey. This is what we want to see. Unfortunately, it says survey report, print version is available for purchase. What it doesn't tell you is the soft copy is not available. So basically, you have to pay them to deliver a print version to your office. They do, to be fair, offer a PowerPoint presentation which contains a summary of those findings, but nothing more. The previous KAP survey, they don't even have a PowerPoint, only the print version for purchase. You have to go all the way back to 2007, where you can find the survey report, right, as well as the PowerPoint. Although the PowerPoint's only in Chinese, I don't care too much because at least you've got the full report. So this to me is somewhat bizarre. So if we look at the PowerPoint presentation, I'm going to switch to their PowerPoint. Just a minute. So their PowerPoint actually is extremely useful. Oh, I see. Sorry. It's their PowerPoint is actually a PDF. So let me open the PDF. So this is a PDF of their PowerPoint. So, Family Planning, Knowledge, Attitude and Practice in Hong Kong 2017, which is extremely useful because it tells us. So I'm just going to show you two bits of this, which I think tell you really what you need to see. This is showing you, okay, parity, for those of you who don't understand the jargon, parity means how many children per family, right? So in order to have replacement of the population, you need a parity of about 2.1, right? So a couple needs obviously at least 2 children. Some of those children will die before they grow up to be parents themselves, so you need about 2.1. So you can see that in 1987, the mean actual parity and the mean ideal parity were both 2.1. So in other words, in 1987, the Family Planning Association overall did a great job. People wanted 2.1 children on average, and people had an average of 2.1. Of course, it's not quite as good as that because, of course, within that, some people had less than they wanted and some had more than they wanted. But at least on average, everybody was happy, right? So some people may be burnt, some people may be frozen, but at least on average, we had the right temperature. But if you look at where we are in 2017, you can see the mean ideal parity has shrunk to 1.6 and the actual is 1.3. Now, there is a slight flaw in this presentation. What's the flaw? The flaw is they were asking women who are still fertile. So meaning their actual parity is less than the parity they will finally achieve. So this is an underestimate. So although 1987 looks great, in fact, the mean actual parity by the time women had stopped having babies was more than 2.1 at that time. But the 1.3 we're at now is clearly too low. These women are highly unlikely to achieve even their ideal parity of 1.6, let alone the replacement parity of 2.1, okay? So that tells us, yes, if we believe that we want the population to be stable, and I actually think that's a questionable assumption personally, but that's me. That's a philosophical discussion. But let's go down and look at the reasons for desiring or not. So reason for desiring to have a child, I think, are not so interesting. I like children. I want my child to have company, children bring joy to life, to carry on the family line, etc. Because if we think there's a shortfall, what we care is, what's the reason for not wanting more children? Okay. Sorry, so that's, yeah, so reason for desiring no children or only one child. So you've got the story for both males and females, and for those who prefer no children or one child. So clearly for the ones no children, you've got about half saying too much responsibility and about half complaining about the financial burden. So this adds up to a lot more than 100%, of course. But you can see the top 3 reasons are responsibility, burden, and I want more time and space for personal development. So that's women with no children, who prefer no children. Women who prefer one child, the primary reason is burden, financial burden, followed by responsibility, and then living space is the number 4, right? So you can see money and space clearly are relevant. So those are areas where arguably the government can intervene, right? By providing more financial support for families with children and providing more space. So actually, we know pretty much. And in fact, for most cities, you will see a fairly similar story. So my understanding, for example, is in the mainland, if you look at mainland cities, there's a similar issue. Well, of course, the mainland previously had the one-child policy. So I would argue Hong Kong shows the mainland, you didn't need to require a one-child policy. Most people will do it anyway, if they have a good living situation. Anyway, so again, we do actually know quite a bit about what influences fertility. Whether the government should intervene and how is a different question. But this tells you clearly financial burden and space are the two key elements of this story which the government can intervene. Okay, let's go back. So that's fertility. How am I doing for time? Okay. Okay, I'm already going a long way through my time, right? So how can we improve the one-way permit scheme? So I'm not going to talk about this one in detail because I think there are other ones which are of much more interest. So the one-way permit scheme is essentially Hong Kong's family reunion scheme. So I wrote a report on this together with several colleagues. So Paul Yip from Hong Kong U, Joanne Lam from Baptist, and other people. This is, I would say, the one-way permit scheme is generally misunderstood by most Hong Kong people because they still had a perception that it's largely uneducated women coming to Hong Kong. While that may have been true 30 years ago, it has not been true for a very long time. The majority of people coming to Hong Kong are educated women. There are also some educated men coming in the one-way permit scheme. And arguably, we do have a moral obligation for family reunion, I would argue. That's largely been missed. So, and there is data, we have data from surveys done by the government which tell us quite a bit about the people coming in. However, is that the reports written by the government itself were sometimes misinterpreted. So, for example, the education level was misunderstood because the tables that people looked at included children together with spouses. So obviously, most children coming to Hong Kong will only have primary or secondary education because they're young. So people misunderstood and thought that, oh, this is all the spouses have low education, which was generally not true. Anyway, there is I will show you a link to the report we wrote. Now that report is arguably outdated, but I would argue the one-way permit scheme is outdated. It should have been closed down at least 10 years ago. Anyway, we can come back to that in Q&A. How can we increase the labor force participation rate? So this one, I want to show you some of the tables that census provides, because I think these are really very interesting, but unfortunately not quite what we want. So let's have a look at some of their tables. Now I've got to find the right one to show you. Right, so we're going to first of all look. Just a minute, let me try the share again. Gender education, the merits of Asian gender. Okay. Okay, can you see my table? So the font size is a bit small. Let me try and push it up a bit. So this is showing you the labor force participation rates by age and sex. They still show it for 15 to 19, which is not very helpful because most people are still in education. Even the 20 to 24, you can see that this first two columns, right? This is male and female labor force participation, aged 20 to 24 from 1985 to 2013. And you can see it started out 88% for males and has dropped to 62%. Why? Because 20 and 21-year-olds are still in education generally, right? Similarly for females. And you can see the female participation rate has matched the male participation rate very closely since 93, right? Let's look down the other end. So 65 and over is problematic because you've got retirees in there, but you can see that the participation rates are starting to go back up again. So the reason I got interested in this, Census wrote a report where they said that the female labor force participation rate for older women is surprisingly increasing again. And I said, it's not surprising to me. It's only surprising to you because you've only shown age and gender. You haven't taken account of the other key variables. So we'll come back to that in a minute. So you can see, though, say 60 to 64, female, having gone from 25 down to 13, has gone back up to 24. And male went down from 58 to 43, back up to 55. So it does appear, okay, labor force participation rates for older men and women are going back up again. But we don't understand why if we only look at this table. So let's switch to another table. So let's include marital status. Let me get the right one. Here we are. This one is age, gender, and marital status. Blow this one up as well. So, never married, 25 to 39. You can see male and female, 95%. So basically, never married and young, well, young to middle age, they're all in the labor force. Unfortunately, this is showing a problem with the tables. It will not let me select 40 to 59 as the other table. It only allows me to do 40 and over because presumably the number of 60 and above is too small. But so we have to be a little bit careful because some of these are retirees. But you can see that for 40 and above never married, it stays stable. Right? So for women in particular, it jumped from 59 in 93 to 78 from 2000 onwards. Even higher than for never married males. Right? So definitely no issue here for the never married. If we look at the ever married, then we see a different story, of course. So males,
Hello， 大家好，今日同大家介紹嘅影片咧係點樣用 slicer 再加個 pivot table 咧去做一個資料分析。咁我見好多朋友啊或者同事咧，佢哋都好少用 slicer 去做資料分析嘅。咁甚至乎有啲連 pivot table 都冇。
The earlier days to being 62 consistently in recent years, right? So quite a high labor force participation rate for females. 25 to 39. Now, the older one, you can see the female rate continues to go up, 26 to 34 to 40. Male stays stable amongst the married, okay? Now,
Hello， 大家好，今日同大家介紹嘅影片咧係點樣用
missing is education. So let's have
Hello， 大家好，今日同大家介紹嘅影片咧係點樣用 slicer 再加個 pivot table 咧去做一個資料分析。咁我見好多朋友啊或者同事咧，佢哋都好少用 slicer 去做資料分析㗎。咁甚至乎有啲連 pivot table 都冇用㗎。
So let's just look at the two extremes of education. So primary education and below. So young males, right? now, of course, there are not many 25 to 39s with primary and below education these days in that group. But you can see that the labor force participation rate has gone down from in the 90s to in the 70s. And for females, it's dropped in recent times, right? If you look at the older males and females, males dropped from 60 to 30, and females stayed stable.
In this tutorial, I will show you an easy way to create data entry forms
if you have low levels of education. Let's look at the other extreme. So post-secondary degrees, male 25 to 39, around 95. Female 25 to 39. This one doesn't have marital status. I can't show that at the same time.
In this tutorial,
but it's fairly stable, right? It stayed about 87. 40 and above, male has gone down a little bit from around the 80s to 76, but the female one has stayed stable in recent years around 70. So the labor force participation rate for females with high levels of education has stayed high, much higher. So in other words, what we saw, those changes, the picture is quite stable once you condition on education as well as gender and age. In fact, you need age, gender, marital status, and education. And then you see a very stable situation with labor force participation rate. All that's changed is the number of people in those different groups, right? So the problem is that you need to do the necessary analysis, and we can't do that with the standard tables. You have to go and basically do the analysis on the census data or pay census to do the analysis for you. Okay, I'm running out of time much faster than I anticipated. So we're going to have to skip some of these. So I'm just going to look at the next one.
Department, and I can put my department in the columns,
and then
I can do all
stop to give you
sorts
a
of
time for
slicing and
Q&A.
dicing.
So this is
And the
about
beauty of
language
pivot tables is you don't
community.
break
So this is
anything.
my example of
You're not
the
changing any of
spatial
this.
analysis using the census data. So what language communities does Hong Kong have? Oral and written. So again, something I'm very proud of is that we help persuade census not only to put back the questions on oral languages, but to add questions on written. There are also questions about the context, what languages you're using at work, home, or social. It's important not just to focus on Cantonese, Putonghua, and English. Level of competence, as I said, you can't get that from the census, so we did that analysis using the thematic household survey. And what I'm going to show you is the geographical patterns. Okay. So what's the geographical pattern? So this is the most boring graph I've ever shown anybody. This is showing Cantonese speakers across Hong Kong at the district level. So the district level, the highest is about 98%, and the lowest is, I think, about 70%. You can see maybe that it's slightly fainter in central and western and Wan Chai. But most of Hong Kong, the vast majority of people can speak Cantonese. However,
in this video, we're going to build this interactive sales dashboard on Adidas that dynamically updates based on our preferences to do with the year, the product, the region, and more. First, we'll go over the data
so
and
let's have a
create
look.
pivot
So this
tables
is
to
looking at
analyze the
Shamshu
relevant
Po. So I'm going to show you the results for two districts, which are very interesting. Shamshu Po is interesting because it has lots of poor people living in poor quality private housing, including subdivided flats. And Yao Chin Mong because it has the greatest language diversity. So this shows you, for example, that Lai Chi Kok South has the highest proportion of Punjabi speakers across the whole of Hong Kong. It's still only about 2%. But you can see that compared to the next constituency, there's basically nobody speaking Punjabi in most parts of Shamshu Po, except in Laichikok South. So if you want to find a Punjabi speaker, that's where you should go. If we look at Vietnamese, it turns out that the highest proportion of Vietnamese speakers is in Nam Son Central, in Shamshi Po, right? 2.5%. If we look at Yau Chin Mong, and you look at Jordan North, we have the highest proportion of Nepali speakers in the whole of Hong Kong, over 30%. So 1/3 of the people living in Jordan North speak Nepali. If we look at Hindi, Yau Chin Mong has the highest proportion of Hindi speakers anywhere in Hong Kong. So about 1 in 6, 1 in 7 of the population in Tsim Sha Tsui Central speak Hindi. So we can clearly do interesting things. So the remaining slides, I'm just going to flick over fairly quickly. So one of the things that came out of this other talk I gave was trying to identify deprived groups. So who might be deprived? It could be recent arrivals from the mainland, it could be ethnic minorities, living in subdivided housing. Those have all been looked at by census in special reports. Or it could be minority language speakers, which I have looked at. So in fact, minority language speakers does not necessarily just mean South Asian languages. It can include Chinese dialects such as Fukien and Hakka. What are the geographical patterns? So we can construct maps just like the ones I showed you. Oh, I didn't tell you one crucial story. So to draw these maps, when I drew them, Lands Department wanted to charge me money for the data for these maps. Now, the data I mean here is the boundaries, right? All the boundaries of the constituencies. Fortunately, I was able to point out that the Electoral Commission had already paid for these boundaries to be constructed, and hence it was not reasonable to expect me to pay money for something that somebody else had already paid for. And Lands Department gave in. However, the boundary data does not include the land-sea boundary. So the land-sea boundary you can see on this map here, right, all around Tsim Sha Tsui, we had to find that from another source and overlay that with the boundary maps. So the government still does not provide these maps in a way that you can easily construct maps like mine. I do, so you can download that information from me, but the government itself does not make it available, which is utterly crazy. Okay, so what is deprivation? So my difficulty with the reports that census provides is that they don't provide a comparison. So for example, if you want to look at people living in subdivided housing, is their deprivation due to living in subdivided housing or due to the fact that they're poor people? And that's why they're living in subdivided housing. So obviously you would want to compare the people living in subdivided housing with other people with similar household incomes to try and understand how they differ. Or if you're looking at language, you would want to compare those to people with different language abilities and see how language plays a role. So, in fact, in my language report, we looked at how to improve employment and personal incomes. So the question, first of all, is what influences employment and personal incomes? That's in the report. Secondly, which elements can the government change or influence? So the key things in terms of employment and personal incomes in Hong Kong are age, gender, marital status, education, and language abilities. Now, the government can't change your age. They shouldn't change your gender, and they shouldn't be changing your marital status. However, they can help you improve your education, and they can help you to learn languages. So those are clearly areas the government can change or influence. And the census data is a great resource for this. And my focus from my next study is going to be the next generation, because the census data collects data on the whole family living in a household. So if we look at children living with their parents, we can do comparisons to see how the children's education and employment outcomes compare to their parents. Okay, how to improve data access. So I won't go through this in detail. Open data policy is something very good. The government has made a good start. Public records law and access to information law, there are consultation papers on the Law Reform Commission website. We don't have the final report. Whereas a big problem is open access for research publications. Hong Kong is far behind major jurisdictions. Okay? So, and I've got a list of references here. So the Hong Kong U Scholars Hub, Google Scholar, the language maps, that you can see the maps like I showed, the 2 Law Reform Commission consultation papers, which I encourage you to read, the census building tables, the Family Planning Association, an open data index, which shows where Hong Kong is behind, my book on research methods, and my report on the one-way permit scheme. Okay? So I'm happy to answer any questions. Lucy, are you going to take over?
Oh, but there's an echo.
Yep.
I can't. Now, is it an echo?
1 second, I'll get you.
Okay, that's
You
fine.
go ahead.
That's much better.
Okay, then. Okay, then. Thank you. Now, I'm taking over as a moderator, as Justine has some kind of unexpected personal affairs to attend to. And thank you so much, John, for being today's speaker. And I have known John for so many years when we were young adults. And now that we are young elderly, well. So, and thank you for letting us know what you have been doing in much more detail. So it has been such a good section. It covers such a diversity of topics, from research methodology, proper use of statistics, and definition, and some of the, like the changing society, and things such as one-way permit, as is being when it was really being conceived so many years ago. Now that the society has changed, do we have to revisit the situation? And then how, or as a definition of population, the mobile versus the usual resident. Some of all these issues they are very appalling, I mean, in terms of the breadth of information. And some of this about fertility and which is an issue with us. So with such a big topic, and I know John also have something about open data too, talking about, it's only about just the tip of the iceberg about open data. Today we see some of the data that you as a scholar has been now in the Hong Kong U Scholarly Hub. And is it linked up with the government? I understand that the CU's, the CUPU, the Chief Executive Policy Unit, has this now has a place for holding the past public policy researchers' reports properly, at least now. But how about other think tanks? Do we have a central repository for all these reports that are compiled by the other think tanks? Is there any place for hosting this kind of reports? So
Well, data.gov does allow people to propose data sets but it doesn't have a place for reports.
I see.
So I think if the reports are in a recognized repository, like the university ones, then it will normally get picked up by Google Scholar. But I think, as far as I know, for example, our Hong Kong, I don't think their reports are being picked up by Google Scholar. So that's a problem. They need to either get Google to index their repository, or they should be putting their reports in one of the university repositories. I don't think it really matters which one. So I think it's really important, because Google, the normal version of Google, is not very helpful because it covers anything, regardless of whether it's good or not. Google Scholar does quite a good filtering for trustworthy information, I would say. Most stuff in Google Scholar can be trusted.
Okay, good. Now, John, you pose a lot of questions, and some of them is to be resolved in over a period of time. So what we are here is just creating the platform so that people can discuss and maybe put into further papers for it to be, say, submitted to the government, etc. So as I told you, we are recording today's seminar, and we will duly present a set of recordings to like the CNSD, to the directorate, and also possibly to the CUPU, Chief Executive Policy Unit, and for all this to be taken further down the road. Now, I know that there are people here who are in the know, like Fred, who was in the commissioner for CNSD for 17 years. So while he might not be answering for the current directorate, but he certainly have some views. So,
well, can I just say something? I mean, I want to make it very clear. I'm very grateful for what Census has done over the years to make their data available and their reports. So the context that maybe is not clear, the UK, which right before 1997, Hong Kong often took reference from, UK went down the wrong pathway of saying that people should pay for access to government data. And I think they realized later on they made a mistake and had to do a U-turn. Fortunately, Hong Kong never went down that pathway. And I think the access to census and statistics data in Hong Kong is generally very good, at least for academics. Now, for people who are not academics, might argue, well, we should also get access. But from my experience in Hong Kong, many non-academics do not understand privacy and data protection and just think all data should be made open data regardless. And you just need to anonymize it. They do not understand re-identification risk. So I think as long as the data is accessible for analysis, that is sufficient for data where there is a privacy issue. But I think for data where there isn't a privacy issue, it should be open. And I think, again, I also give a lot of credit to OGCIO, who have done a lot in the last 5 years in particular to make government data sets, more government data sets open. But the problem is there's still many government data sets which are still not open. So I've made myself extremely unpopular with certain parts of the government for criticizing, even in closed door meetings, for saying that they haven't made data available, which I know they have, but they insist they don't have. So I think some parts of government are very sensitive. So census and statistics are the good, and OGCIO are the good examples of how we can improve matters through making data more accessible, but the other parts are not. So that's why those two laws are so important. So let me just say a little bit about that, Lucy, because I think the government records law is crucial, because in the consultation paper, it says, in effect, that public bodies will essentially just be the government itself, which is a terrible proposal. Most things in Hong Kong which are funded by the government should be considered public bodies. So, for example, the universities. So the example I showed you at the Family Planning Association. So about half of their money comes from the government. Now, I don't know who had the stupid idea to start charging for their reports and only making the print reports available. I mean, that to me is utterly ludicrous, let alone the data set. Now, in practice, if you talk to them in the past, I haven't talked to the current